case is a case of the acute osteomyelitis. This is a real case. It was missed. So originally this patient came, they thought it was an accident, they thought it was a fracture. In reality, it was not a fracture. Patient had otitis media, and most of the time the osteomyelitis actually, especially in children, comes from another source of infection. This patient was an infection of EU, and then that infection can go and stuck in the bone and produce osteomyelitis. Remember, in this age group, most common location is a metaphysis, have all these vascular loop. Based on age, the location is a little bit different. If you think about the neonate, in neonate actually, the vessels in the metaphysis enter to the epiphysis, so they penetrate epiphysis. So in neonate, when you have an osteomyelitis, you're gonna have an involvement of epiphysis and joint too. In children, until the physis is open, mainly gonna stay on the metaphysis, so it's gonna be osteomyelitis. In adult, when the physis closed, again, the infection not only can involve, can go in the metaphysis, but also can involve epiphysis and subchondral bone. As a matter of fact, in adult, one of the common locations for acute osteomyelitis is epiphysis and subchondral bone. In this patient, the growth palate was open, was missed, and was acute osteomyelitis. Most common etiology is the staph aureus. As I said, most of the time it's hematogenous. Sometimes it can be penetrating trauma. I'm sure you all know that microorganism depends on a disease. For example, somebody has sickle cell, salmonella, somebody is an IV drug abuser, think about Pseudomonas, E. coli, Klebsiella, somebody have a urine infection, again, E. coli, so these are some that you need to know, but most commonly is staph aureus. So, if you don't treat it, become chronic osteomyelitis. And the problem is, if there is an infection and dead bone over there, the only way you can treat it, you have to take that dead bone out. This is what happened when it become chronic. You have a dead bone at the center. We call this sequestrum. And then you have a reactive bone around, and we call it involucrum. The main important point is you cannot give the antibiotic. This is not going to dissolve. You have to go surgically, take this out. What are the features of acute osteomyelitis in histology? Acute, neutrophil, loss of neutrophil. These are destroyed bone, all mineral material. You see neutrophil here. This is a high magnification. Again, neutrophil. Sometimes you can see bacteria. When they become chronic, you see more lymphocyte. You see dead bone at the center. You need to go in, take it out. And there are some fibrosis. That's it.